Did you know that some medications you take every day could be quietly destroying your mind without you even realizing it? Worse yet, they could be contributing to the rise of devastating neurological diseases like Alzheimer's, Parkinson's, and dementia, sometimes even striking before you turn 40. In today's episode of Info Health, I'll reveal this hidden danger that most doctors never tell the public about. And, as I always do, I'll share a simple home remedy that can help protect your brain health and your quality of life as you age, ultimately saving you and your family years of unnecessary suffering by simply making smarter choices every time you walk into a pharmacy. These diseases, which used to seem so distant, are now closer than ever. Shocking new studies show that not only are they becoming more common, they're also affecting younger and younger people. 10 years ago, Alzheimer's in the young was almost unheard of. Now, medicine is detecting cases in people under 40. The scariest part? Today, the World Health Organization has officially diagnosed 55 million people worldwide with dementia. The most famous case these days is Hollywood actor Bruce Willis, whose struggles were made public by his family as a social warning. A powerful reminder of the suffering this disease is inflicting on humanity. What's truly alarming is that the World Health Organization predicts this number will grow to 139 million by 2050. That means the number of people with dementia could nearly triple in just 25 years. And what makes this even more concerning is that lifestyle choices, things like obesity, lack of physical activity, and depression, especially in places like Latin America, are some of the biggest drivers of this epidemic, and right now, Brazil is one of the biggest current examples. So get ready to discover how your everyday choices can make all the difference to your longevity. And don't forget, at the end of this video, I'll share a practical natural solution you can start using today to protect your brain. This is your invitation to understand and learn how to take care of what's most precious for any human being, your mind. Let's work together to reverse this frightening trend and build a healthier future for our families. Share this content with anyone you want to protect as soon as possible. And tell us in the comments if you or someone close to you has ever faced these problems at home. Leave your support for this cause, helping to change the world and save lives with knowledge. That's what Info Health is all about. Let's get started. Did you know that today's rising neurological diseases, like dementia, Parkinson's, and Alzheimer's, not only affect a person's mind, but also their body, soul, and entire family? How do you uncover the hidden secrets behind this growing epidemic? Let's take a closer look at what these diseases are, how they destroy us and our loved ones, and what you can do to prevent them. So now let's go. Do you really know what dementia is? Dementia is a term used to describe a set of symptoms that impact memory, thinking, and even the ability to perform daily tasks. Contrary to popular belief, it's not a single disease, but a group of conditions that lead to significant cognitive decline. It often starts with small memory lapses, forgetting names or appointments, but can escalate into something much more serious. In advanced stages, a person may lose the ability to communicate, recognize family members, or even feed or bathe themselves. Dementia doesn't just isolate memory, it deeply alters overall brain function and quickly affects the body. It begins with simple lapses, like not remembering where you left your keys. But as it advances, brain damage spreads, hurting reasoning, behavior, and communication. Over time, normal tasks like cooking, eating, driving, or bathing become impossible without help. In the most severe cases, the person loses the ability to recognize even their own family, which can be emotionally devastating for everyone involved, getting worse until total dependency is reached, almost like returning to infancy. In the most severe situations, even swallowing becomes difficult, making eating a real danger and sometimes requiring feeding tubes. The person also becomes vulnerable to secondary complications, like infections and malnutrition. These impacts show just how debilitating dementia is, turning what many mistake for just a mental issue into a heartbreaking cycle of dependency and suffering for both the person and their entire family. How would you feel having to care for someone with dementia? Or worse, needing to be cared for yourself, dependent on others for even basic needs like going to the bathroom. Imagine watching a loved one slowly disappear before your eyes, unable to recognize you, a feeling of complete powerlessness. Thinking about this only highlights the urgent need for self-care and basic knowledge to help protect ourselves from a condition that's spreading worldwide. Before we continue, let me tell you something important. If you want to take prevention seriously, strengthen your brain, lose weight with health, and achieve true longevity, download our free ebook right now, How to Lose 20 Pounds a Month, No Matter Your Age. It's completely free for a limited time, linked in the first pinned comment and in the video description, with exclusive food lists, meal plans, recipes, and proven tactics for transforming your routine, gut health, quality of life, physical, and mental health. Don't wait. Grab yours before it's paid again. Now let's go. How much do you know about Parkinson's? It's a progressive neurological disorder that not only steals movement, but also disrupts crucial brain functions. It's as if the body gradually locks up while the mind struggles to stay clear and active. Parkinson's is mainly known for its motor symptoms: tremors, muscle stiffness, and slowness of movement. But what few realize is that it can also cause depression, anxiety, and even dementia in advanced stages. This combination brings not just physical suffering, but psychological pain, not only for the person, but for everyone around them, forced to watch this slow, painful decline. Now, pay very close attention, because what I'm about to explain could change the future for anyone silently suffering from this, especially since Alzheimer's is the most common form of dementia and often goes unnoticed. Its symptoms are easily confused with normal forgetfulness. That means a lot of people show early signs but don't seek help, thinking it's just stress or normal memory lapses, when in reality, they're developing Alzheimer's at a frightening speed. The problem starts when we think we know what to do, taking memory pills, vitamins, or just eating better and taking time off work, instead of seeking a real medical diagnosis. But quick action can make all the difference in slowing the disease and preparing families for what's ahead. Early symptoms of Alzheimer's are sneaky. At first, it's just small lapses, forgetting details from a conversation or where something was placed. But then, people have trouble planning or solving simple problems, like following a recipe they've always known or managing bills. As the disease progresses, changes in mood and behavior become more obvious. Apathy, irritability, suspicion, often for no clear reason. Disorientation in time and space is also common, getting lost in familiar places, or not remembering the day of the week. Spotting these symptoms early is crucial for getting medical help, since early diagnosis gives more time for interventions that can slow the disease. It also helps families prepare, emotionally and logistically, for what's to come. While Alzheimer's mainly affects memory and reasoning, Parkinson's starts with movement problems and, in advanced cases, can also lead to dementia-like symptoms. Both conditions are progressive, and unfortunately, there's no cure yet. But catching the signs early can really improve quality of life and slow the progression. Now that you know what these diseases are and how they impact lives, let's go deeper into the hidden side. Most doctors never talk about, because many of the factors driving these diseases are part of everyday life. Stay with us to learn how to protect yourself and your loved ones. Like this video, share it with those you want to help, subscribe to our channel, and let's keep going, because this is where things get real. While these conditions are often confused, their differences are crucial. Knowing how to spot them can save years of your life. The medications we use every day can be allies in protecting our health, but some may hide dangerous risks, especially when used long-term or without proper medical guidance. Medications that are commonly prescribed or even bought over the counter can have side effects that directly harm your brain health. Among the most commonly used and potentially dangerous are the benzodiazepines. These drugs are widely prescribed for conditions like anxiety, insomnia, and other nervous system disorders because of their fast and effective sedative effects. But what most people don't know is that when used long-term, these medications can have serious consequences for the brain. Medications like diazepam, clonazepam, and lorazepam act directly on the central nervous system, slowing down brain activity and creating a feeling of calm. While these effects can help people suffering from insomnia or anxiety in the short term, using them continuously can lead to chemical dependence and, even worse, make it harder to form new memories. This brain alteration is especially worrying for older adults, where prolonged use is linked to a higher risk of dementia. Benzodiazepines don't just harm memory, they can also mask the early symptoms of serious neurological diseases like Alzheimer's. That can delay diagnosis, which is critical for treatment and slowing the disease. Many people continue taking these drugs, believing they're fixing an immediate problem, when in fact they're making the long-term neurological outlook even worse. An official medical study published in the BMJ, British Medical Journal, one of the world's most respected peer-reviewed journals, analyzed a group of older adults in Canada and found that using benzodiazepines for more than 180 days doubled the risk of developing Alzheimer's. Researchers believe this may be due to the structural changes these medications cause in certain parts of the brain. Another study, a meta-analysis reviewing the cumulative impact of these drugs, found that dementia risk can increase by up to 49% for every 20 additional doses taken in a year. This association was especially strong in Asian populations, but also had significant effects in North America and Europe. It's important to note that while there's a clear link between benzodiazepines and cognitive decline, there's still debate about the cause. For now, the recommendation is to use these drugs only in low doses and for short periods, always with careful medical supervision, ready to withdraw them at the first sign of cognitive changes. So, if you or someone you love uses benzodiazepines, it's crucial to consult your doctor to reassess the real need and discuss safer alternatives. Often, cognitive behavioral therapy, lifestyle changes, or other medications can provide similar results with far less risk. Remember, your brain health should be a top priority, and making informed choices can shape a better, healthier future. Next, let's talk about anticholinergic drugs, which are commonly used for allergies, gastrointestinal disorders, urinary incontinence, and even Parkinson's symptoms. While they offer fast relief, this class of drugs is known for side effects that impact the central nervous system, especially in older adults. The main problem is that they interfere with acetylcholine, a neurotransmitter vital for memory, learning, and attention. Some of the most common anticholinergics include diphenhydramine in many allergy and cold medicines, scopolamine for cramps and nausea, atropine used in eye drops and emergencies, ipratropium, common for asthma and respiratory diseases, tolterodine for overactive bladder, bipyridine, amitriptyline, promethazine, and chlorpheniramine, a popular antihistamine for allergies. These medications are widely prescribed, but require special care due to side effects that many people don't even realize exist. Here's what studies have shown. Long-term use is associated with a 30% to 54% increase in dementia risk for older adults, depending on the dose and duration. A major study by JAMA Internal Medicine followed over 3,000 patients aged 65 and up, finding that 3 years of continuous anticholinergic use greatly affected people's cognitive abilities. The impact can be so severe that even moderate exposure can cause confusion, trouble focusing, and symptoms similar to Alzheimer's. A research article published in the British Journal of Clinical Pharmacology found that patients who used anticholinergics for more than 90 days suffered a violent drop in cognition, hurting memory and logical reasoning after just 3 months. Given these risks, doctors and patients should seek safer alternatives whenever possible. For allergies, always prefer second-generation antihistamines like loratadine or cetirizine. They're less likely to affect your brain. For urinary incontinence, consider behavioral therapies like pelvic floor strengthening, learned with a physical therapist, or newer medications like mirabegron, which may have less neurological impact. If anticholinergics are absolutely necessary, specialists recommend the lowest possible dose for the shortest time with strict medical monitoring for any cognitive symptoms, especially over the medium to long term. This monitoring is crucial to spot early warning signs of brain problems, so treatment can be adjusted before permanent damage sets in. Symptoms like frequent memory lapses, trouble with daily tasks, disorientation, or mood changes could signal your brain is being affected. Family members and caregivers should always watch for these changes and seek professional advice immediately. Only trained health professionals can use tools like the Mini Mental State Examination, MMSE, to spot early cognitive decline. Early detection allows treatment to be adjusted, reducing risks and improving life quality for the patient. So remember, while anticholinergic drugs are useful medical tools, they demand extreme care. Awareness of their effects and a commitment to safer alternatives are crucial for protecting brain health and preventing neurological complications as we age. Now, have you heard of statins? They're well known for lowering cholesterol and protecting against cardiovascular disease. For most people, they're considered safe and effective, but recent discussions have highlighted possible side effects, especially with long-term use, on both brain and muscle health. Statins like atorvastatin, simvastatin, and rosuvastatin work by inhibiting an enzyme in the liver that produces cholesterol, helping to prevent heart attacks and strokes. However, studies show that statins can be linked to problems like muscle pain, weakness, and in rare cases, severe muscle damage, myopathy. There's also evidence that statins can interfere with memory and cognitive function. Research shows that around 10% to 20% of patients report muscle symptoms, and severe muscle complications, though rare, happen in less than 0.1% of cases. Some people, especially older adults, have experienced trouble remembering words or doing simple tasks, but these effects are usually reversible after stopping the drug. Importantly, the cardiovascular benefits of statins usually outweigh the risks. To minimize adverse effects, doctors might adjust your dose, switch statins, or suggest medication breaks. Healthy eating, regular exercise, and weight control are also recommended to reduce the need for medication. So remember, recognizing possible side effects early is key. If you notice muscle weakness, cramps, or memory changes, tell your doctor right away, so your treatment can be adjusted, keeping the heart benefits without harming other aspects of your health. Next, let's talk about something many people rely on: medications for insomnia, especially the so-called non-benzodiazepine hypnotics like zolpidem, zaleplon, and azopiclone. These drugs are widely used because they help people fall asleep quickly, a common solution for those who struggle with sleepless nights. But using them long-term raises some real concerns. Studies show that, although these meds work well in the short term, they can actually hurt your sleep quality in the long run. For example, they negatively impact deep REM sleep, the phase crucial for body regeneration and memory consolidation. This can severely worsen cognitive problems in people already at risk for neurological diseases like Alzheimer's. Long-term use is also linked to confusion, daytime sleepiness, dizziness, and falls, especially in older adults. The Ministry of Health has reported that zolpidem is still one of the most prescribed drugs for elderly Americans, even though it can cause dependence and drive people to increase their doses over time. There are even rare cases of strange behaviors during sleep, like sleepwalking, temporary amnesia, or even driving without awareness. Imagine taking a pill for a good night's rest, then waking up at the police station, having done something dangerous you don't remember. How would you feel? That's why more people are turning to therapeutic alternatives, like sleep hygiene, avoiding electronics and artificial lights before bed, using aromatherapy, even adjusting your bedroom with feng shui principles, or cognitive behavioral therapy for insomnia, CBTI, which has shown long-term success without the risks of medication. For those who need hypnotics, medical recommendations are clear. Use them only with strict supervision, at the lowest effective dose, for the shortest possible time, while starting alternative therapies to make it easier to taper off. This approach minimizes risk and helps restore real, healthy sleep, so life can be longer and far better. Now let's address one of the most controversial classes of medication in modern society: antidepressants. These play a vital role in treating depression and anxiety, helping millions reclaim their quality of life. But certain types can have serious neurological side effects, especially if used long-term or without close medical supervision. Among the best known in America are the tricyclic antidepressants, amitriptyline, nortriptyline, and imipramine, which have anticholinergic effects that interfere with acetylcholine. A key neurotransmitter for memory and learning. Messing with this system can truly change the course of your mental health. Studies show that while these medications can be effective for mood disorders, they may harm cognition, causing confusion, trouble concentrating, and, in extreme cases, contributing to cognitive decline, especially in seniors. Other antidepressant classes, like selective serotonin reuptake inhibitors, SSRIs, fluoxetine, sertraline, escitalopram, are considered safer in terms of cognitive effects. But even these can sometimes cause attention problems and mental fatigue. A European study revealed that patients who took tricyclic antidepressants for over a year had a 30% higher risk of developing mild cognitive impairment compared to those who never used them. The link between antidepressants and dementia is still being debated in the scientific community. To minimize these risks, alternatives like cognitive behavioral therapy, CBT, have proven effective for treating moderate depression without the neurological dangers of medication. Regular exercise, a balanced diet, and meditation are also recommended as part of treatment. Despite these risks, antidepressants are invaluable tools for managing severe mental illness. Prescription should always follow a careful medical assessment, with regular monitoring to adjust doses and catch possible side effects early. Besides these already discussed, there are other medications that are more common than most people realize, and some are even acquired illegally, especially through shady online marketplaces. Antipsychotics, widely used for schizophrenia and bipolar disorder, like haloperidol, Haldol, and risperidone, Risperdal, work by altering neurotransmitters such as dopamine and serotonin to relieve symptoms like delusions and hallucinations. But long-term or inappropriate use can bring devastating consequences. Research shows these chemical changes can trigger dementia in seniors, especially when antipsychotics are given to people with pre-existing dementia, often without the patient or their doctors even realizing. Other side effects, like muscle stiffness, tremors, and excessive sedation, can also reduce quality of life. Opioids, such as morphine and oxycodone, are essential for managing severe and chronic pain, often used by cancer patients. These drugs act on receptors in the central nervous system to reduce pain, but carry alarming risks, including chemical dependence and structural changes in brain areas responsible for emotional control and memory. And last but not least, we have proton pump inhibitors, PPIs, like omeprazole and pantoprazole, widely prescribed for acid reflux and stomach ulcers by reducing stomach acid. While effective for symptoms, long-term use is associated with nutrient deficiencies, especially vitamin B12, which is crucial for neurological health. This deficiency can lead to cognitive decline and increased dementia risk, as well as disturbing your gut microbiome, which may indirectly affect your brain health. Congratulations, and thank you to everyone who stayed with me this far. That's a real sign you're committed to your health and quality of life. And as always, after all this information, I want to share something practical, something that can truly change your life if used wisely. Let's talk about the powerful benefits of coconut oil. Coconut oil is widely recognized for its many health benefits, but one of the most intriguing is its potential to support healthy brain function. It's rich in medium-chain triglycerides, MCTs, which are rapidly metabolized by the liver and converted into ketone bodies. An alternative energy source for the brain, especially when the body's ability to use glucose is compromised. Studies in journals like Neurobiology of Aging suggest that ketones can improve cognitive function in patients with neurodegenerative diseases like Alzheimer's. Research by Dr. Kieran Clark of Oxford University shows that an MCT-rich diet can boost brain energy levels in healthy people and seniors with mild cognitive impairment. Dr. Mary Newport, a palliative care specialist, famously documented the positive effects of coconut oil for her husband, who had advanced Alzheimer's. In her book, Alzheimer's Disease: What If There Was a Cure?, she describes improvements in memory and behavior after adding coconut oil to his diet. Although this is a single case, it inspired further research into the neuroprotective power of ketones. Chronic inflammation is a key factor in neurodegenerative diseases. Coconut oil contains fatty acids like lauric acid, shown to have anti-inflammatory effects in lab studies, reducing inflammatory markers and supporting neuron health. Coconut oil's antioxidants help fight oxidative stress, a major driver of brain aging and cognitive decline. Reducing oxidative stress can improve memory and protect neurons from damage, so there's growing evidence that regular coconut oil consumption may help maintain cognitive function, especially for seniors, promoting mental clarity and sharper memory. To start, try 1 tablespoon per day to test your body's tolerance, and gradually increase up to 3 tablespoons daily if needed. You can take it directly as a natural supplement, add it to coffee, or use it in place of refined oils in cooking to preserve its nutritional value. Coconut oil isn't a miracle cure, but evidence shows it can be a natural way to boost brain health when combined with a balanced diet and healthy lifestyle habits. This is just a taste of what coconut oil can do for your brain and your health. If you want a full video, with all the benefits, the risks, and the best ways to use it without falling into the trap of overuse, comment below. I want the coconut oil video. That way, I'll know it's worth preparing a special guide for you and everyone else who needs this info. Now, if you want to go even further and discover one of the greatest secrets of natural medicine for preventing these diseases and rejuvenating your brain and mind, don't miss our next video about the famous golden milk. Called the Elixir of the Wise, this recipe blends neuroprotective spices, powerful antioxidants, and results proven by science and some of the biggest names in Hollywood. This ancient formula could be the key to safeguarding your brain, your memory, and ensuring a long life with full clarity. Click the cards to learn how to make this miracle drink, and subscribe now so you never miss another exclusive health guide episode. See you there!